Thank you very much, very kind. And I'm happy to be with you again. Every time Alam invite me, I'm very enthusiastic, and I have to leave many jobs just to attend his talk. Today we would like to thank first of all for your kind invitation, but let's give you something to take home. When somebody talk about public health, it needs to hit in your mind 3 P's. The first is promoting health, is preventing, and prolonging life. So you put it the order you want. 3 P's when somebody talk about public health. Mainly is prevention, secondly is promotion, thirdly is to prolong life. And this can be the definition, you can add it according to the United States or the UK or WHO. The health service in general, it's something to be organized by health policies. So health policies, we promote for certain type of disease, don't smoke, don't eat too much salt, don't eat too much fat, obesity is going on, do physical activity and so on. This is the promotion, and all coming from the big boss, the Minister of Health. And then the health service is the one to deliver the service. You can see public health is complete here because it's starting with promoting and to prevent disease. And if somebody gets ill, we move them to the health service where the hospital can take care of them. If you look at in the MENA country or region, you can see that the Ministry of Health, or some countries called Ministry of Public Health. So it doesn't matter, but on the whole 22 countries, as my colleague explained, they are mainly the care provider here is the Ministry of Health. And they are the one to put the health policy, the one to do the health service, and arrange for the budget. And if we look also, some countries, not all MENA's countries, they have the health insurance organization. Both of them work together in certain countries to help and provide the health care for the population. The MENA, you can see there are lots of definition for Middle East, but we talk about it in general. It's an area of great vitality and diversity, need, and innovations. The major public health success during the 20th century, by the CDC, the Center for Disease Control in America. They say that we managed to control many infectious disease, vaccination and immunization across the whole world now, healthy food and water supply, and also water chlorination started to be bringing a good outcome in terms of killing lots of germs and so on. Maternal and infancy mortality rate is gone down. It used to be one of the main cause, and the kids are at risk under 5 years old because of lots of infection happening at the same time, and without a proper vaccination or water supply, the kids and the mother may be at risk. And by putting this point together, we are in a better environment, better sustainable planet than before. But still there is some challenges for the MENA region. The public health in a good number of MENA countries face major challenges, particularly the public health. So the health provider is not as much. You can see in certain countries, like say the Gulf, you can see particularly Qatar, Bahrain, and so on, they are very strong in the health service. Comparing to other parts of the MENA region, they are not having such kind of 5-star. When I say 5-star, it doesn't mean luxurious, but the nurses, the GPs at very, very high profile and professions. And poor governance in some countries, not all, squandering of resources, economic regression, inequities. This is one of the major point here, and illiteracy. My colleague already explained this. Inequity here for those who are low socioeconomic level within a good average economic country, where you can see the accessibility to the health service by the high socioeconomic level is higher than those who don't have the means to pay for the visits and so on. Public health challenges facing it, that the stark difference, as I said, some countries are rich in the Middle East, others are not. Something are moving economy and booming, in fact, booming very well. The other is not really doing well. Poverty is mainly around the Middle East, illiteracy, poor health, and overpopulation in certain areas. And there is inequity problem, new emerging disease. I want you to keep an eye on health transition. We have a health transition happened during the last 30 years in the Middle East. We used to be suffering, as Professor Oldham was explaining, that he was there and the situation was there in 1970s, but from 1970 to 2013-14, we are in different world there. And this is thanks to some of the countries have a proper increase in their economy, and therefore the health transition has shifted to a different angle. And with the shift of health transition, we can see other crises started to show in terms of health and disease. But mainly, again, we can look at some crises in the region happening. There is a war in Iraq. There is a war in other parts of the region. There is some changing of regimes, and you can see the Arab Springs and so on. All this happening, so the health service is at risk at that stage. And also worsening by the social, economic, and environmental determinant of health is gone a bit below average. The social determinant that I meant here is the inequality in health services still sustaining problem. The women empowerment and enablement, this is one of the major points on the WHO agenda. And child labor and street children, many of them now, certain countries are poorer than the other. And lifestyle and behavioral change, this is my specialty, diet, physical activity, and so on. We've gone sedentary lifestyle, kind of. We only meet, as my colleague Paul has explained, it's a good point to meet on food. And that's very true in the Middle East. People gathering and they have something to be served and provided to them while they are gathered, to talk and so on and so on. Conflict and emergency, this has also happened. Migrant worker moving from one side to the other, they're bringing their tradition, their lifestyle to the new settlement country. If you look at the life expectancy has increased, as you can see. It used to be, this is the Middle East, the purple one, this one. This is the Middle East. Now we are talking about 2012. It's gone above just about 70 years old, the average. We used to live up to 60 years old in the 1980s, and the average life used to be at up to 50 in earlier, 1965. People die almost when they got 50 and above, heart attack or deficiency of certain micronutrients. The life expectancy, the map in 2010 has improved, and we are living in the Middle East here, and everyone has added to his life is about 13. And thanks to the healthcare service provided, that it can indicate or diagnose certain type of disease quicker, so people can get the proper treatment at the time. And if we compare now between different countries, the life expectancy, you can see that majority are over 70 years old for male and female, but female sometimes get higher than male in their life, so they live longer than male. And changing dynamics according to this, that we need to do more education to the population in order to learn how to diagnose their disease earlier, and hence they start to see their physician or GP and nurses and so on. But unfortunately, some governments have inability to provide a proper comprehensive health service. Some of them just check, do some analysis, lab test, blood, urine, glucose in the blood, and so on, and that's it. You are okay. Perhaps you carry on with some type of medication to reduce the symptom rather than curing the root of the disease. Sustaining health system is one of the very important on the health reform for the Middle East. If the Middle East want to reform the health sustainability, it has to be on the top item there. Widespread distribution of risk factor of disease such as smoking, obesity, hypertension. There is no country in the world today not suffering hypertension, by the way. Everyone have a hypertension problem. And you know, this is the beginning of cardiovascular disease and other related disease. Profile burden in the MENA. Communicable disease, it's happening. Did we get rid of it? Not yet. High incidence of non-communicable disease, it used to be before. No, it started to come in and in very, very large scale. So non-communicable disease used to be really rare comparing to the Middle East 40, 50 years ago. We used to have micronutrient deficiency, vitamin deficiency, and so on. Now we have both of them, communicable and non-communicable disease. Increasing incidence of death and disability due to violences, and the mental ill, again, is another of the disease coming up to hit the whole world now. Mental illness in UK now is becoming a second or third major disease in UK, let alone in the proper diagnosis in the Middle East, we will have a large number as well. Communicable disease, HIV, by definition, HIV is the disease that it's come communicable by having a sort of fluid transacted from one infected person to the other. And that to make the person less able to combat or to fight the other disease. So it reduces the immune system. It's actually affecting the immune system. And when this is moved forward, it goes to the AIDS stage, which is the final stage of this. HIV is not that heavy infection, or we don't have a proper statistics in the Middle East on this particular type of disease. So the fact that we are on the green zone in this area, it doesn't mean we are safe of it, or most probably we don't have a proper stats for it. Infant mortality rate used to be one of the major diseases in the whole world, particularly in the developing countries. And infant mortality in MENA or the area Middle East and North Africa, child survival control, diarrhea particularly, and acute respiratory infection. And this is type of two disease can make the kids, actually affect the kids less than 5 years old. And that is very, very vulnerable person under 5 years old, where the measles hit, and also some diarrhea because of the unsanitized water, as well as the other growth need, the body is growing. So all this come together, the child may be at risk of mortality. So infant mortality rate and under 5 mortality rate decrease rapidly. And the rate is indicated that there is a decline, and hopefully by 2012 we will be meeting the Millennium Development Goal of the WHO. Water, sanitized water, you can see there being improvement in the Northern Africa, and most of the 90% of people have accessibility to chlorinated water now. Vaccination has been improved, and you can see, according to the WHO guidelines, most of the country vaccinate their kids, and there is a follow-up by the primary care to allow to contact the mom, so the mom can bring the kids to get different type of jabs and vaccination here. Hepatitis is increasing in the Middle East, and this is something need to be addressed very early. Immunization coverage is almost at 93% in 2000, and I predict now it's going to be almost at 95%. The proportion of 1 year old children immunized against measles has increased, and hopefully by 2015 will be 100% all immunized once they're born. The mortality rate is reduced and declined, but is still high at certain area like Somalia and Djibouti and so on, particularly for infant here. This is for mother, when mother died after the birth of a baby. When we look at vitamin A and iron, vitamin A is very important for the child to grow well and the immune system to fight back disease. But you can see we are in the mid-range, but not many countries really in the Middle East has a vitamin A appropriate level, so we're still suffering in the Middle East. Iron is somehow, yes, we are percent of child that we have a deficiency, 63%, and this is high number. People are anemic. So we have a problem with micronutrient, and this is due to the lack of appropriate food. Food could be there, but is not appropriate or adequate intake. The GDP percentage expenditure on health, it's increased, and you can see Lebanon, Jordan, I can't see this, but Egypt and so on, they are the health care getting a good we spend well on the health care from the national or gross domestic products. You can see also the per capita total expenditure. You can see it highly in Qatar, UAE, Kuwait, Lebanon, Bahrain, Saudi Arabia. Those are the one investing largely on the healthcare services. This is the number of physicians and nurses per 10,000 population. Bahrain #1, Qatar, Egypt, Lebanon, and so on. So that means that's the indicator and parameter where you can compare the health services between different countries. And some countries are doing very good, the others just need to do lots. Health transition, I spoke about it earlier. There is dramatic decline in the infant and child mortality, that's fine. And there is increased control of vaccination, another good news. But we have an emergence of chronic disease in adulthood as a major contributor of premature death, disability, and healthcare costs. So we have a problem here. We are moving towards another pattern of disease rather than characteristic traditional orthodox kind of disease. What we have here, non-communicable diseases start to show. And we have some countries, like some Middle Eastern and Gulf state has experienced now high income per capita. So we can see that the lifestyle has accordingly changed. And this is a change of structure of the population, diet, physical activity. People become affluent. They can afford to have servants or maids. They can afford to have people working for them. They can afford to phone and for home delivery. So there is different cars, drivers, all these things hasn't been there if we talk about 30, 40 years ago. So there is emergence of obesity accordingly. And obesity is a common problem worldwide. And unfortunately, I haven't seen a country manage to overcome obesity to date. We don't have a country say, we combat obesity. Here we are. And if we look at obesity, if I have one extra minute to just explain to you, obesity is very simple to control it. If you have a good will, I mean changing behavior. Because we know obesity is high intake with less physical activity. 95% of obesity is high intake of food with less energy expenditure through physical activity. And therefore, we need to do this. Doing this is just manipulate your mind. You shouldn't eat. People on weekend put on weight. We are putting on weight on weekend, if you remember this word. Because you wake up in the morning, you want to have a full breakfast, you want to have to think about where I'm going to have my lunch, and then within 3-4 hours, I would like to have my dinner, good dinner. So all this happening while you are not expending any of this, it's going to accumulate. It's like a bank. You get in money in, and it will never spend it, so it will stay there. And I will tell you, as small as one cookies, you've seen in the morning today this chocolate cookies. One cookies can, every day you eat it, of 150 calories for you, you end up by 1 year, within 1 year, 2.5 kilograms of body weight. Full stop. This is exactly experimental. Eat one cookie, you don't need it, those excess of what you need, you eat one cookies of this every day, in 1 year time, I will put you on the scale, I will see you 2.5 kilogram extra.
I didn't tell us earlier.
No, I didn't touch it. Nobody asked me. And I don't want to spoil the event at the beginning anyway. Driving forces behind nutrition transition. So we are in real nutrition transition community. We move from health transition, started by economical transition, health transition, nutrition transition. We are not doing enough of physical activity, but we are keen to have our 3 meals every day. People used to walk, now we are changing, and now we are using fast train and airplanes and moving from one A to B, having your breakfast in Paris and dinner in London, having your breakfast whatever and dinner somewhere. So it's so different world today. And we are used to prepare our own food, go to the market, buy it, wash it, and start cooking. Now we have home delivery. You just see what next could become, what the next course is going to be. So it's so simple. The manufacturer of food and food processing encourage us to have more extra calories to our diet. We used to sit on the table with the family and everybody talk and eat, talk and eat, talk and eat, which is a very good practice. But now everybody eat. And in fact, it's being transitioned and it has moved, and we have now kids just like eat out. So we have in the nutrition transition, we used to be in the green zone, now we are moving to the dark one. And the obesity is a big family, apparently. And that's the third name. If you look at it, you have hypertension, you have cardiovascular disease, you have diabetes type 2, you have cancer, you have lots of things come together with the obesity. So we have lots of these things coming up just by 1 extra kilogram I added every year. The obesity is part of the non-communicable disease, and this is hitting differently according to whether you are in developing country or developed country. You name it, but all this disease happening around the world. Middle East is not far from it. So we have overweight and obesity is almost 1 billion human living on this planet suffering it. While you're comparing to hunger and undernutrition, less than 1 billion. If you compare micronutrient deficiency, up to 2 billion. Add this together, almost a third or half of our total population today suffering from a problem. You can see the problem is coexisting. This boy is overweight, this one is malnourished. So you have, that's what I'm saying, a real double burden of disease is happening now. You can see it in the Middle East very clear. One school have same class, but a boy overweight. I've seen one boy in Kuwait, 80 kilogram at 10 years old, 80 kilogram. And that was a survey we were doing with Kuwait University. So that's, you can see it is happening and coexisting in one single class. We need to intervene. We used to intervene on this boy before, now we need to intervene on both. So the problem of obesity is being bigger problem for developing country because no more limited resources, late recognition of the problem, kind of. Culture factor favoring overweight. Used to be traditionally people, when they try to get married in the Middle East, they usually go and choose the overweight bride. They don't go for the thin, slim one. No, it has to be, it used to be kind of mentality, but now changed, and you can see size 0 start here already. Continuing challenges, changing obesity and prevalence, significant increase over 10 years in many regions. And you can see it is not neglecting the Middle East. Middle East is all on all menus now. Decrease only in enforced dietary restriction and physical activity. You can control it easily by reducing your intake according to the day that you are starting. If you're going to work, have your breakfast. If you don't go to work and you are off today, think, why I should really eat heavy meal? Why don't I have light meal today? In fact, you'll stay healthier. If you run or go jogging or something, that's something out of your kindness. So we used to have the burger in 1981 looks like this, but it changed, and now you have triple beef burger, and you have to widen up your belt now more and more. And you can see the multi line here showing which type of the obesity has increased, and this is the Middle East, the purple one, which is the people putting in weight according to their age, and this is the age people. Look at this, 60 to 69, people start to put on weight. Here it's going up. If you look at the Europe here, can you see Central Europe? It's going up. People kind of, around 45 to 69, they start to put on weight here. The consumption, if we have the map of fruit and vegetables, is the lowest one in this age. When you start to go away from fruit and vegetable, you start to put on weight because you are eating meat and meat products and eating more onto the non or unhealthy diet. The dietary intake, you are for male, you need 2,500 a day, average male adult. For female, you need about 1,900 to 2,000 a day. But in this zone area here, you can see you are exceeding these values I just mentioned to you. So we are taking more than we are spending. The nutrition transition already happened in the Middle East and North Africa, and these are the different countries where you can see the obesity for either male and female. You can see when you add more of income, when you have more income coming in, your mean cholesterol is going up and your body weight get more heavier. So that's what you can see with, this is very interesting graph, where you have more money in your pocket or bank, you get more cholesterol and you get more body weight. This is a different type of disease, and mainly Africa for men and women. You can see here also the Middle East, that you have ischemic heart disease. The menu added now, rather than just undernutrition, now we have the double burden. Ischemic heart disease, you have hypertension, you have stroke, you have diabetes, colon cancer, or you name it. So achieving the global chronic disease goal would result in an estimate 36 fewer chronic disease deaths between 2005 and 2015. This is very interesting. So just reduce the intake. You reduce the chronic disease related to the high intake. You can save 36 million deaths by between these 10 years. The changes that we can see it here, we need to focus on dietary change are great, good successful point. Physical activity to shift to increase, and the message here, at least 30 minutes of moderate activity 5 times a week. So we need to be physically active, or just do more exercising if you are able to, at least 30 minutes 5 times a week. That's what. For kids, 1 hour every day, but for adults, at least 30 minutes. Not 30 minutes, at least. So if you do 45, it's for your own benefit. The diabetes is starting also to be worldwide. Most of the countries in the world suffering from type 2 diabetes, and thanks to the obesity existing. And this is just the lack of physical activity. So if we look to compare the agenda now with 40 years ago, we used to have acute child infection, maternal death, mother died after the operation or the delivery or something, and why? She is poorly nourished, or say there is have some bleeding or something, and the baby is weak, is not getting enough breastfeeding and so on. So you get into a square where all related to a poor, poverty community. But now we have chronic, lifelong infectious and non-infectious disease. Simple technology we used to use all time for the healthcare. Now we have complex intervention. We need intervention to reduce hypertension, to stop smoking, to cardiovascular, all type of big intervention which need lots of money to implement it. This used to be rapid impact. This is decades. We will have decades before we see how obesity can be reduced. Control by health services. This is main level levers outside health service control. My colleague today was talking about stakeholders. There is a big need for stakeholders to be on board all the time to support. Within the remit of the health campus, this takes a whole university and government. Health system is neglected, and Europe are doing very well with the surveillance system. There is a center for surveillance. And usually, the rest of the world follow what United States and Europe doing in this system. Prevention and public health, that's the easier way. To prevent the disease rather than sit down and cure it. Take you lots of resources, money, and effort. And main causes of suffering, not death, mental health. Mental health is becoming now type 3 diabetes, because they found a correlation between Alzheimer and the unrecognized blood glucose level by our own body. So they start now they are discussion to name it really type 3 diabetes for certain mental illness. Toxic environment, Professor James has just simplified. We have brilliantly built an environment guaranteed to make people obese. We have designed a society that guaranteed to make people unfit. As I said, dietary change or lifestyle change in general, including physical activity and the health outcome, we will be reducing all the non-communicable disease and saving the MENA country as well as other countries the big bills of healthcare. Opportunity now, we need, there is a clear rapid shift, but we need to do prevention more and find environmental changes, the obesogenic environment. The environment can lead us to become obese or overweight. We'd like to change it. If you can park your car one station before your final destination, park it there and walk this, at least you are doing some physical activity before you have your lunch and so on. Addressing challenges, we need an intervention necessary, policy development, health professional and education, we need to educate them, and we'll focus on health care, must move from hospital to home. People start to prevent the disease to happen rather than waiting to the GP to start to address them. Improving leadership, fair, adequate financing, we need providing universal access. There is a very interesting database on many hospitals. I've seen it in the Middle East, particularly GCC country, where they have access to or record of the patient from anywhere, any computer in one single country. So if this person move from one A to B, they still can meet their nearest point of health care, and there and then they can prescribe for him to continuation of medication or prescribe new intervention. Cost effectiveness intervention is the requirement, health promotion is major, supporting community-based initiatives. As we said, we need to move from hospital to the community. Revitalization disrupted health service due to different crises, addressing the challenges of health, determined globalization, poverty, gender, and the environment. What we need now is MENA Health Policy Forum, and this is, we need to share experience, first of all, and applying this forum will help us to sort different point of accessibility to healthcare, appropriate healthcare, decent one at free of charge or at cheap payment, equity. There is no difference between high socioeconomic and low socioeconomic. We need equality as well, and addition health insurance if possible, which is most of the country, I'm aware they are putting health insurance also in support of the Ministry of Health. This is what the WHO can offer the Middle East. If somebody want to contact, they help with technical support and the capacity building as well. You can send your staff to be trained in the WHO regional office and so on. Assist national government intervention. They are really doing a brilliant job. Foreseeing of for the public health in MENA, we would like health and health equity on the political agenda, and we need the professional, public health professional to get engaged and take the responsibility further, and hopefully they work together to have the health reform. Thank you very much for your attention. I'm happy for any questions.